All right, let's jump right in, shall we? Buckle up, because today's deep dive into healthcare news is a wild ride.
It's a packed one for sure.
We're talking Trump shaking things up again, RFK Jr. still making waves, and AI, well, AI is everywhere as usual.
Always.
But first, breaking news out of the White House.
Yeah, the Trump administration really threw a curveball this time.
They hit the pause button on federal grants, right?
Exactly, and nobody really knew what was going on at first.
I bet that caused some chaos.
Oh, absolute mayhem, especially for states trying to handle Medicaid. Picture this. You're a state official responsible for making sure those Medicaid payments go through, and boom, you can't even access the system.
That's a nightmare scenario.
It was a scramble, to say the least.
Right.
Lawmakers were up in arms, worried about the impact on people who rely on those programs.
Makes sense. Those are essential services.
Thankfully, a judge stepped in and put a stop to the freeze, for now.
So, crisis averted, but
But it definitely raises questions about what happens when the federal government pulls the rug out from under everyone like
Yeah.
that.
it's a power struggle, isn't it? The feds versus the states when it comes to healthcare.
And speaking of power struggles, let's talk about the guy Trump wants to head up HHS, Robert F. Kennedy Jr.
Oh, yeah, that's been generating a lot of buzz, hasn't it?
A lot of controversy, too, especially around his views on vaccines.
Right. Some experts are outright saying he's unfit for the job.
The Atlantic even ran a piece called "Doctors Must Fight the RFK Nomination." They're worried about his past statements and theories that lack scientific backing.
And this seems to connect to a bigger trend we've been seeing. Less trust in institutions like the CDC and FDA.
Yeah, that KFF poll showed a dip in public confidence.
It's like people just don't know who to believe anymore.
It definitely makes it harder to get public health messages across, that's for sure.
All right, let's move on to something a little less contentious. AI.
Although AI can be pretty contentious too, depending on who you ask.
True, but it's definitely exciting. It seems like AI is popping up in every area of healthcare now.
It's moving fast. On one hand, you've got companies like Quibim. They just got a massive $50 million investment to develop AI for medical imaging.
Wow. So what's the goal there?
Earlier and more accurate disease detection.
Mm.
Imagine being able to spot those warning signs before things get serious.
That could be a game changer.
Then there's Baycare Health System. They're testing out AI voice tech to help nurses with all that clinical documentation.
Cutting down on paperwork, that's a good thing.
It could help with burnout, too, give nurses more time to focus on patients.
So AI sounds like it has the potential to really revolutionize healthcare.
Absolutely. But we need to be realistic, too. It's not all going to be smooth sailing.
What do you mean?
Well, some experts are warning about the costs, overspending on AI, and then there's the whole data security question.
Right, we can't just hand over all our health information without making sure it's protected.
Exactly. And there's the risk of becoming too reliant on AI. What happens if the systems fail?
So it's about finding that balance,
Yeah.
right? Harnessing the power of AI, but using it responsibly.
And that means careful planning, testing, and always putting patient safety first.
It sounds like we're on the verge of a major shift in healthcare with all this new technology.
We are, but we can't forget about the challenges that are still out there, like heart disease. It's still the leading cause of death in the U.S.
It's easy to get caught up in the shiny new tech and forget about the basics.
We need to keep focusing on prevention and treatment for those widespread conditions alongside the exciting AI developments.
And then there's the financial side of things. Hospitals are struggling right now.
Uncharted territory is how some CFOs are describing it.
Uncharted territory. That doesn't sound good.
Some health systems are even facing bankruptcy. It's a tough situation all around.
It's almost like healthcare is being pulled in two different directions. Incredible innovation on one side and this intense financial pressure on the other.
And trying to balance those two forces is going to be key in the next few years.
But there are some positive developments too. What about that interstate medical licensure compact?
That's a good one. It makes it easier for doctors to practice across state lines.
So that means more access to specialists, especially in areas that are underserved.
It's a policy change that could really make a difference for patients.
It's good to hear about some progress being made.
It's not all doom and gloom, that's for sure.
Now, let's talk about something that caught my eye. Advocate Health closing those in-store clinics they had at Walgreens.
Interesting, isn't it? It makes you wonder about the whole retail health trend.
Are those partnerships really working?
It's hard to say for sure, but this move by Advocate Health might be a sign that things are shifting.
It'll be interesting to see if other companies follow suit.
And then on the flip side, you have Massachusetts General Hospital partnering with the Matthew Perry Foundation to create an addiction medicine fellowship.
Yeah, it's a pretty unique collaboration.
It is, and it shows how seriously people are taking the addiction crisis.
It's good to see organizations coming together to find solutions.
We need all hands on deck for this one.
So we've got healthcare partnerships evolving, AI pushing boundaries, and some pretty serious challenges still looming.
And we're just getting started.
We've got a lot more to unpack in this deep dive, so stay tuned.
It really highlights the need for a more holistic approach, bringing different perspectives to the table.
Absolutely. And while we're seeing these innovative partnerships, there's still this elephant in the room. Healthcare finances.
Yeah, that's a big one.
Hospital CFOs are practically walking a tightrope right now.
They're dealing with rising costs, staffing shortages, and all this uncertainty about reimbursements. It's a tough spot to be in.
It seems like a real paradox. We've got all this amazing technology coming out, but the financial foundation of the system feels shaky.
It is, and the strain is starting to show. Some health systems are on the brink of bankruptcy.
That's a scary thought. What happens to patients if hospitals start closing?
It's a ripple effect. Access to care gets disrupted, services get cut. It's a tough situation all around.
It makes you wonder if these financial woes will put a damper on all the advancements we're seeing.
It's a valid concern. Can hospitals afford to invest in cutting-edge tech when they're barely keeping the lights on?
It's a tough balancing act. But let's look at the bright side. There's some good news about access to care, like that Interstate Medical Licensure Compact.
That's a step in the right direction. It breaks down those barriers that prevent doctors from practicing in multiple states.
So patients in rural areas, for example, might have an easier time finding specialists.
Exactly. It's about removing those roadblocks and making sure everyone has access to quality care.
It shows that policy changes can actually adapt to the evolving needs of the system.
And that's important because policy plays a huge role in shaping how healthcare works.
Before we move on, I want to circle back to something we touched on earlier, that growing distrust in government health agencies. It's a worrying trend.
It's a complicated issue for sure, but that KFF poll showed a clear drop in public trust for the CDC and FDA.
And it's not just random skepticism. It's fueled by misinformation and conspiracy theories.
Social media has made it easier for those narratives to spread like wildfire.
And when you have people like Robert F. Kennedy Jr. openly questioning vaccine safety, it adds fuel to the fire.
His nomination has definitely brought these issues to the forefront.
It's a challenge for healthcare leaders. How do you build trust when people are so skeptical of authority?
Transparency is key. And clear communication, you have to be willing to engage with different perspectives.
Maybe it's about finding that common ground, reminding people that we all want a healthcare system that works.
That's a good point. Focusing on shared goals and values could help bridge the divide.
Okay, let's zoom in on some specific stories now, starting with those advocate health clinics closing at Walgreens.
That caught my attention too. It raises questions about the whole retail health model.
Are those partnerships sustainable in the long run?
It's hard to say, but Advocate Health is a major player, so this move could be a sign of things to come.
It'll be interesting to see if other companies like CVS and Walmart rethink their strategies.
And then on a completely different note, you have Mass General partnering with the Matthew Perry Foundation.
That's an unexpected duo. What are they up to?
They're creating an addiction medicine fellowship, which is pretty awesome.
Matthew Perry has been open about his own struggles with addiction.
And now he's using his platform to make a difference.
It's a great example of how diverse organizations can team up to tackle a serious issue.
Addiction is a public health crisis, and we need all the help we can get.
Speaking of public health crises, we can't forget about the tuberculosis outbreak in Kansas.
It's a serious situation, the largest outbreak in U.S. history.
It's a reminder that infectious diseases are still a threat, even with all our medical advancements.
Early detection and intervention are crucial.
We need to be prepared to respond quickly and effectively.
And now, for something a little less heavy, let's talk about AI again.
AI is always a hot topic. It's like the future of healthcare.
And it's moving fast. We're seeing new applications all the time.
Like Quibim, they're using AI to analyze medical images.
Their goal is to detect diseases earlier and more accurately, which could be huge for patient outcomes.
And then you have Baycare using AI to help nurses with clinical documentation.
That could free up a lot of time for nurses to focus on patient care.
So AI has the potential to streamline processes and improve efficiency.
But we have to be mindful of the risks too. Data security, over-reliance on technology.
It's about finding that sweet spot, using AI to enhance healthcare without losing the human touch.
It's a delicate balance, but one that's worth striving for.
And that's a wrap for the Mexican. Part 2 of our deep dive. We've covered a lot of ground, but there's still more to come. We're back for the final stretch of our healthcare news marathon.
Ready to tackle some more headlines?
Absolutely, and we've got some big ones to cover, starting with this executive order on gender-affirming care for minors.
That's certainly sparked a lot of debate.
It's a sensitive issue, for sure, and this order aims to restrict federal funding and support for that type of care.
It's raising questions about the government's role in healthcare, especially when it comes to young people.
And this is still a developing story, right?
Absolutely. The full impact is still being analyzed and discussed. It's something we'll definitely be keeping an eye on.
We'll keep our listeners updated as things unfold. Now, let's switch gears to a public health concern. That tuberculosis outbreak in Kansas.
Yeah, that's a serious situation.
Officials are calling it the largest tuberculosis outbreak in U.S. history, which is pretty alarming.
Tuberculosis is a contagious bacterial infection mainly affecting the lungs, and while it's treatable, it can be deadly if not caught early.
This outbreak really highlights the importance of public health infrastructure.
We need to be vigilant about preventing and controlling infectious diseases.
It's a reminder that even with all the medical advancements we've made, we can't let our guard down.
Absolutely. These threats are still out there, and we need to be ready to respond.
Okay, for our last story today, let's talk about something that affects all of us.
Yeah.
The cost of healthcare.
It's a perennial issue, and it's not getting any easier.
It seems like costs keep going up, putting a strain on everyone.
It's a complex problem, but there are people working on solutions, and we've got a report here that outlines some potential strategies for making healthcare more affordable.
Now that's something I want to hear about. What are they suggesting?
Well, this report from a leading healthcare think tank emphasizes a few key things, like price transparency.
So patients can actually understand what they're paying for.
Exactly. And then there's promoting competition among providers, giving patients more choices.
That makes sense. And what about value-based care?
That's another big one, shifting the focus from the quantity of care to the quality of care.
It sounds like a good approach, but it's probably going to take a lot of effort to implement these changes.
It's a long road, but it's essential if we want a healthcare system that's both high quality and financially sustainable.
Well said. And that brings us to the end of our healthcare news odyssey.
We've covered a lot of ground today, from political shakeups to groundbreaking technology.
You've been an amazing guide through this whirlwind of information.
It's been a pleasure. And remember, the healthcare landscape is constantly changing.
It's up to all of us to stay informed and engaged.
Advocate for the kind of healthcare system we want to see.
A system that's equitable, accessible, and puts patients first.
Couldn't have said it better myself.
Thanks for joining us on this deep dive into healthcare news. We'll be back soon with more insights and analysis.
Until then, stay curious and stay healthy.